oh, this, we've done this, we've done this, we've done this. Oh, and he goes to church and all of this. And the accountant just held his hand up and said, David Koresh also did all those things.
That's a good.
I know. And it was like the manager just got up and walked out.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle, finally, from Carlin. Yeah, so you were like trying to run toward the storms last week or something. I don't know what you're doing. You're down in Florida.
I know. Well, one of my besties lives in Key West, and I can go visit anytime I want.
I don't blame you.
And apparently, the storms know this, and
that you bring them every time,
and they want to come visit. I mean, I narrowly missed the landslide in Alaska and cyber attack. I mean, I don't know.
Yeah,
it's fun to hang out with me, and then again, not. There you go.
Yeah, I prefer to come see you rather than you come see me. You bring stuff.
Yeah. Don't let the word get out. No one will let me go anywhere anymore.
I know. So today we have a few interesting topics, as we typically do, but we got one that's really kind of a nightmare about a dental record request. So if you know a dentist, I want to share this with them. It's kind of crazy. So we'll dive into that. We also got some other things to talk about, just real kind of quickly cover a few things that we're starting to see and get into it, because there's never a shortage of things to talk about when it comes to privacy and security.
No.
Yeah. So
it's just trying to decide which ones. That's the thing we have the hardest time with.
Yeah. Yeah. Because you've got to, reduce the noise. That's what we're here to do. Just bring you to things you really need to pay attention to.
We're either reducing the noise or we're part of the noise.
Well, I'm sure at times we are both, but for now we will reduce the noise. So I do want to say a big shout out to all you who listen, who donate, and who head over to helpmewithhipaa.com and check us out. Find out what Don and I do to actually put food on the table. And if you need our services, let us know. We'll be there to help.
Yes.
Do want to give a big shout out to Alex Farling, one of our longtime listeners. I ran into him at a recent conference, and he's actually a big deal in the IT community. So I was like, he's like, I've been listening for years. It was kind of funny because I think it's one of those times where, and you've probably had this before, Donna, where you meet somebody and they're like, I know that voice. And then they see your name and like, oh, you're the guy. So I think it was kind of like that. I don't think he recognized who I was immediately. Then it was kind of like, wait a minute, that sounds familiar. And that name, oh.
Yeah, I've had the voice thing happens a lot. I had somebody walk past me at a luncheon one time and stop. Like, big, lots of tables, and they like stopped and come back around. You!
Yeah, it took a minute, but I figured out who you were.
I heard you talking.
So, and interestingly enough, I had somebody reach out to me yesterday on LinkedIn, and they mentioned Alex, and they said, hey, I just talked to Alex earlier today, and he mentioned your podcast, and said, I'm going to start listening to it. So thanks, Alex.
Thanks,
I appreciate
Alex.
That. That's a big compliment when anybody refers somebody to our podcast. So really appreciate that.
Yeah. We appreciate any help that we get in making this not go out into the ether and be lost. So.
It would never. All right. So let's start with what we talked about a few weeks ago. We mentioned that I think KnowBe4 had hired an IT guy. Turned out it was somebody from North Korea, and they caught it really early, and they completely did the right thing and got rid of the guy and all this good stuff. So nothing happened. However, as of yesterday, I saw another article And it was, hey, a remote IT worker from North Korea was hired by somebody. And I'm like, wait a minute, is it the same thing? But no, it's not the same thing. So I'm like, all right, maybe it's a pattern here.
Yeah, the Justice Department put out a thing saying there's thousands apparently thousands of IT workers, And at first they were just looking for a way to make some money, a regular paycheck, apparently, that then they could funnel back into the coffers in North Korea. But now they found out, hey, we can do some more here.
Yeah. Why get a paycheck when we can have a ransomware?
Yeah. Thing. If you stop giving us the paycheck, then guess what we're going to do if you get us in there far enough?
Yeah. I mean, that's the thing about it. You're outsourcing your IT, which happens more and more and more, especially with everybody doing remote work. And that's one argument you could say about going back to the office is that people aren't doing remote work, and therefore they're not potentially hiring remote workers that could be anywhere.
Yeah. And it's they're, first of all, it's identity theft. They're taking on the identity of somebody else. So you do the background checks and they check out.
Mm-hmm.
And you can make your computer look like it's coming from a lot of places. Mm-hmm. So, it all checks out in your basic reviews. However, we've got to find better ways to catch these folks, because this case was that 4-month employment before things went horribly awry.
Mm-hmm. Yeah, 4 months now. Imagine you give somebody access to your systems, your data for 4 months, only to find out they're one of the bad guys.
An IT worker.
Yeah. I mean, and it says they did an employment history and checked his personal details, but he falsified all that. So, I don't know how deeply they went down that rabbit hole of checking those things, but certainly if you're going to hire an IT guy, you need to do some, background investigations on it. Hire a company that does this and do a little more due diligence.
Have conversations.
Yeah, really.
Multiple ways. And,
so it says he used some remote work tools to infiltrate the company's systems. Now, I'm not sure that how much infiltration he had to do if they gave him access, but it did say that he downloaded a large amount of company data, which is something you should probably pay attention to. If, you've got a large amount of data moving around or moving off your systems, first of all, would you even know?
I know, right?
That's your first question.
Yeah.
Or is that something that you would know? Is that something that your IT vendor would even know? Do they have anything set up to look at that?
Well, you remember KnowBe4 sent them a company laptop, and as soon as the laptop setup they started trying to subvert some of the security, which triggered all of their, and they stopped them the minute that they were trying to do the infiltration kind of things.
Yeah,
but this is not so good, because they didn't discover this one until after the fact.
Yeah. They fired him for poor work performance.
I know, right?
I don't know. It depends on what he was being measured on, but apparently he was performing some work. It just wasn't what they wanted.
Yeah.
But then after he got fired, then they received an email demanding a 6-figure sum in cryptocurrency so that he wouldn't publish the data he stole or sell it online.
Yeah.
So, wow.
So imagine if this was an IT provider to healthcare, and they were able to get in and take the data from a healthcare client.
Mm-hmm.
And first of all, imagine any IT worker doing that in healthcare. They can.
Yeah.
It's not out of the question.
No,
that's number one.
And this is a ransomware attack. It's not what we typically see. We don't, we typically see the encryption happening and all that kind of stuff, but this is ransomware.
Yeah.
In a different
thing.
Yeah, in a different way. If somebody took the data and they're sending you a ransom note, they just did it in a way that was a little novel, but apparently not. We're starting to see more and more of it.
Yeah. So it's like we're not going to do anything but, sell your data. We're going to steal it and sell it.
Mm-hmm.
So, yeah. And after that happened, then they brought in SecureWorks, who found that, because it's not clear that they knew right away. They said that they started getting evidence, emails with attachments with evidence the data had been stolen. And then they get the 6-figure email demanding the money. Then they call SecureWorks, who then says, oh, by the by, this poor performing IT person is what caused the problem.
Yeah. HR is like, oh my gosh.
Yeah. So it is something that we have to figure out a way to be much more diligent in capturing those. And it's not easy. But if you're going to hire somebody that has this level of access and these kinds of capabilities, and you're going to give them, let them connect to everything where they could still, even do more, it requires more than just your basic background checks and credit checks. It requires a lot more.
Yeah. And you might want to put things in place to kind of watch them as far as what they're doing. And I'm not talking about cameras and such like that, but just controls in place to make sure, because you should have seen that a large amount of data was being moved or copied or whatever. That should have been something that got picked up by security.
Yeah, I mean, used to, and I may have told this story on another episode, but it was one of those where it got my attention years ago. And, once you get my attention, it sticks. But we had a rule that you couldn't get a key to the office until you had worked there for 90 days. Right? Where I worked before.
Reasonable. Mm-hmm.
Right. And one of the managers had an employee that had been there 60 days and wanted to give him a key sooner because they needed him to come in early or stay late to do something. They, it was like their job. And, it's like, we can't keep waiting for the 90 days because this is their job. We want them to go ahead and do it now. And they go to the guy that's in charge of handing out the keys and make their argument, this, we've done this. Oh, and, he goes to church and all of this. And the accountant just held his hand up and said, David Koresh also did all those things.
That's a good.
I know. And it was like, the manager just got up and walked out. It's like,
what do you say?
Yeah.
What do you say?
All right. Yeah. Just stop. And, you could have gotten all of that in 60 days. So it was, it's that telling moment of how far do you go? And even then 90 days, maybe not. But, I always say that if you make a business change in a small business, definitely a big one, not so much, but a small, medium business, if you make a significant change, bringing somebody on, change something big, it takes 90 days for you to notice it, for it to really impact the business. So, I mean, that's a reasonable amount of time, but we should be doing that now because we're giving them the keys to the kingdom day one.
Yeah.
We should be having some probationary period where they're under extra scrutiny. Because they could be the North Korean. It's not David Koresh now, it's the North Korean.
It's the North Koreans.
Yeah. It's the North Koreans. So, yeah.
All right. So if you're hiring folks and they're remote workers, especially IT, I mean, you got to do more. You got to do more.
Yeah.
Can't take the risk.
Yeah.
So, all right, let's jump over to something that's very interesting because I never would have thought that trying to get your dental records would hurt more than a root canal. But apparently it can.
Yeah, it can.
And this is because of our 50th HIPAA right of access enforcement action.
Yeah. And all you people who think you know all about security risk analysis, note to self. That's 50 cases since 2019, and that included COVID. And this year they announced a similar enforcement initiative for security risk analysis. I'm just saying. So, 50th.
It's coming.
50th.
Yep. 50.
50 years old. For those of you.
Me and you both passed out a while back.
That's a Molly Shannon Saturday Night Live thing. So, for those of you who remember it, you know, and I kick. All right. Anyway, random. You never know where we're going. All right. So I don't even know how to describe this one. We just have to. It's bad. It's bad.
So let me start by saying, and because I say this almost every time, and it bears repeating because, you know, we have 10,000 new listeners a week. And so we need to say this. But if you just look at the title, you miss all the good, juicy stuff. If you just looked at, dental office has to pay civil money penalty of X dollars. I mean, that's what the headline is. But the juicy stuff is what tells you what went wrong, what you should probably not be doing.
Yeah.
And also what you should be doing.
Mm-hmm.
This is why we go through these things, so we can tell you this is what happened. Make sure you're not doing these things in your practice, especially you dentists out there, all two of you who listen, and make sure that you are doing these other things that OCR is saying that this firm, person, company, practice should have been doing.
Uh-huh. Well, yeah. So go ahead and do Melody Fonts Rayner's quote.
All right, so we'll start out with that. And the quote is, an essential hallmark of HIPAA is the right to patients' timely access to their medical records. And by the way, dental records are medical records. Patients should not have to make multiple requests and file complaints with HHS, OCR to get their own medical records. This investigation marks OCR's 50th right of access enforcement action. Healthcare providers should get the message loud and clear. When a patient seeks their medical information, you must provide it to them, period. Yes, she said, period.
Yeah. And loud and clear.
Yes. You know, like we've done this enough.
Yeah.
We must shake you. It's like, get it now.
Yeah.
But you know, it really, when they start doing it though, for the assessments, the security risk assessments and stuff, I'm just wondering what that's going to be like.
Yeah. After seeing the things that are happening here, but I mean, I know the things that we've seen and continue to see. So
let's talk about the timeline of this mess, because it really is. It's not even the fact that it took so long for things to happen, and kind of spoiler alert, we still don't know if the person got their records, but just the things that happened after the request. And I mean, it's a mess. All right, let's get into it because there's a lot.
All right. So this goes back to April 8th, 2019.
Mm-hmm.
Patient for Gumb's Dental, which first of all, we're just going to have to get this out here because it's going to come up several times. Gumb's Dental. Okay, that's cool, but it's also Dr. Gumb.
Yes.
Gumb, and then Gums Dental. Gumb's Dental, Dr. Gumb. Okay.
I have to say though, if your last name is Gumb and you went into the dental field, you were born for this.
That, or you gave in to all of the jokes and said, okay, fine, I'll do it.
I know. All right, here we go.
All right. So patient sends in a request, says, I would like my records for myself and my minor children. Send it to me in an email. Now,
okay,
we've covered this for years. I remember when I used to do my conferences and seminars and stuff, and I'd say, if a patient asks you to email your records, can you send it to them via email? And they'd all be like, no. And I'm like, you're wrong. Well, now that rarely happens. That word has gotten out. So it's been a long time since everybody in the room thought that. And there might be a straggler, but overall, we know you should be able to email. So this should not have been hard. So Gumb's Dental responded to the email request that same day, saying, yeah, I mean, it was great. You're thinking, oh, okay, well, okay. Saying, here's how many times each of you have visited the office.
That's not quite what I'm looking for when I'm looking for medical records.
But no medical records. So May 1st, they filed a complaint saying, hey, you're not doing this. So whoever it was, in a very short amount of time, knew they could file a complaint with OCR.
Yeah. And how many times have we told folks that you are more likely to probably fall under investigation because somebody files a complaint against you because you're not doing what you're supposed to be doing?
Yeah. So, So they file a complaint on May 7th. OCR contacts them, sends them the thing, so that a letter that this is the way it always works. Now, if they don't know you, this is the way it works the first time. But once they know you, all bets are off. So when your name shows up, they first look and say, oh, well, we don't have them. We haven't, had another investigation. So we're going to do what they call technical assistance. We're going to tell you what the law says, and we're going to encourage you to follow the law. In fact, they even say, they basically say, here's what HIPAA says. And, this has been alleged. We want to be clear. This is what HIPAA says. Now, here's a key piece of that. Because if the complaint had nothing to do, like it didn't apply to HIPAA, like you weren't supposed to be doing what the complaint says you weren't, if the complaint says you're not doing something and you're not supposed to do it, they don't tell you you're right. They don't bother you. They tell the patient, no, that doesn't apply. Right. So the fact that they go to tell you this is what HIPAA says means
you ain't doing it.
You might want to reevaluate. And it encouraged them to share this with their staff and to do training and to really assess and clear it up. And if they hear from you again, we might do, if you show up again, we ain't playing no more. We'll do an investigation. June 26th, the patient then, because then they notify the patient and say, look, we gave them technical assistance. They're supposed to do it. So the patient says, great, I'm going to send an email. I'm going to ask for my records again. And I'll tell them, look, send it to me via email, send it to me, whatever you need to do. Here's my address. I want my records. So 30 days later, filed another complaint. August 2nd, 2019. So from April to August 2019, it's too long, but it's not even close to how bad this is going to get. OCR then sends a request to Gumb's Dental. Wait. August 2nd, they file the complaint with OCR. August 26th, they also send a written request. And then OCR says, hey, send us some information. We need you to explain to us what you're doing here. And when they get that request, usually that's where people are like, oh, we better do something.
Yeah.
We better pay attention. There's no evidence that they've gotten multiple requests at all that they did anything with these additional requests, by the way. They did nothing. They ignored them. So then OCR sends them a letter about the complaint asking for specific information. Now, we've seen these many times.
Mm-hmm.
That OCR letter that says, we're opening an investigation and we would like some information. That usually makes people freak out a little bit.
Yeah.
Apparently not these people.
No, they took the ostrich approach.
They did nothing.
Yeah, no response.
So September 5th, they send the letter. Then they do nothing. October 8th, OCR leaves a voicemail following up. Crickets. October 31st, they leave another voicemail. So don't tell me how evil these people are.
I just think it's funny that OCR called on Halloween.
I know, right? Ooh. But they didn't care. They didn't care. They ignored it. They continued to ignore it.
If you just ignore it, it'll go away.
Yeah. And then we know, then COVID happened. Because, shortly, they give you X amount of days to respond. So then, we're just going to, from now on, when there's a gap, then COVID happened. We'll move on. Right.
Yeah.
So a year later, October 1st, 2020, OCR is fine. Here's the deal. You are clearly violating HIPAA. You won't respond to us. Here's your corrective action plan. And here's $75,000 you're going to need to pay us.
Ooh.
So that's the first time they said, cha-ching.
Yeah.
Well, on October 22nd, so boy, that got a response for the first time ever. Dr. Anna Gumb, I'm sorry, but sent an email to OCR stating her justification.
Oh, Lord. So your first communication is fighting back.
I am allowed to do this. And the first response is, and here it, okay. If your story keeps changing, then right away, there's a lot.
Yeah. I would say that, OCR communicated or contacted her on October 1st. She responded by email on the October 22nd, which tells me she spent 21 days trying to come up with all the ways.
Yeah. What am I going to say?
Yeah, exactly. Oh boy. But she didn't do a very good job of coming up with justifications.
And she said they refused to pay a flat fee of $25 to have the medical records mailed certified to them. Okay, right away, that means you're not paying any attention to the stuff they sent you, which says you can't do that.
Nope.
And the patient has already said, I asked for them an email. Or mail them to me. And I'm not asking for anything. No. And a flat fee of $25. You can't charge a flat fee of $25. No. So clearly, Dr. Anna Gumb at that moment is demonstrating not only have I ignored you and your authority, but also I haven't looked at anything you sent me. So OCR picked up the phone October 27th, so 5 days later, and spoke with Dr. Gumb.
What? Oh, they finally got her on the phone.
Yeah.
She must have thought they were going to say, we're so sorry. We're so sorry we bothered you. You were absolutely right.
And so Dr. Gumb says, I want to present my case to the judge. I immediately, when I read this part, I thought about one of those, the court TV things where they come in and you got the two people and you're always looking at that one person that's there like, really? You think that you should argue this? Yeah. For some reason, whenever you visit somebody in the hospital, those are always on. I don't know why. But she reiterated that they refused to pay the flat fee and then added in that they're going to use these records to commit insurance fraud.
So she went from they won't pay to let's throw some more on there. Let's make some assumptions that they're criminals.
Yeah, and so I'm going to. What was it that you said earlier? I'm not going to give you this laptop because you might hack somebody.
Yeah, that'd be like me saying I can't sell you this laptop because you may use it to hack somebody. I can't give you internet service because you might do something nefarious.
I know.
Like, first of all, not your job. And secondly, if you did think that was the case, did you call law enforcement? Did you call insurance companies? Did you call anybody? Or
evidence.
You just made the assumption?
Do we have evidence?
No.
So
not that we know of.
If I think something, as a kid.
So here's my assumption, and it is completely an assumption.
But see, you're saying that.
Yeah, I know. I'm thinking that this person requesting the records is such a thorn in her side that she thinks maybe I can get them in trouble by saying they're trying to commit insurance fraud. So it puts, it just makes it more aggravating for the other person. That's the only thing I can think of.
Well, even if she's right, it doesn't matter.
You're right. It doesn't matter. That's not her job.
She can report it to somebody who's in charge of figuring that out, but that's it.
Yeah.
Look,
it's their medical records, and you are required by law to give it to them.
Yeah.
What they're going to use it for do not matter.
Yeah. I'm taking your car keys from the valet, and I'm not giving you your car because I think you're going to rob a bank, and you're going to use that as your getaway car.
Yeah. Okay.
Well, then tell the police.
That would be like, I can't sell you this car. You might speed.
I know. This is not, if you're right, let's just say you're right. You still can't do this.
Yeah.
Which
being
is
right.
Yeah.
Being right on that aspect still makes you wrong in this aspect.
Yeah. And so they're saying, so on November 9th, they send a letter in writing that it's because they refuse to pay the flat fee, $25, which we've already made clear the law doesn't, you're not allowed to do that. From the get-go, you're not allowed to require the flat fee of $25 at all. But that's going to be number one. And then number two is going to be because I think they're going to commit fraud. All right. So OCR points that out. You can't. The patient asked for it in an email. So number one. Number two, you don't get to make a flat fee just because the patient said you can mail it to me. That doesn't happen. And again, it's not your job. And they even point out where they said, even if Dr. Gumb's allegation that the complainant wanted to submit a fraudulent claim was true, a covered entity may not require an individual to provide a reason for requesting access.
Mm-hmm.
And the individual's rationale for requesting access, if voluntarily offered or known, is not permitted reason to deny access. Not your job.
Yep. Just mind your business. Mind your own
damn business. So December 8th, first of all, I have never seen them use this term before, and I love it. OCR issued a letter of opportunity that they call a LOO or a loo. You've been to the loo? I've got to run to the loo. All right. Letting them know the investigation found you failed to comply. You are not complying. And we're going to give you one more opportunity.
Yeah.
Give us evidence of mitigating factors. Give us evidence. And we'll consider. And the doctor sends back on January 4th, 2021. So here we are, January 2021. April 2019 is when this started.
Yeah. Almost 2 years later.
The doctor responded with the assertion that the denial was done to prevent insurance fraud, and that made it acceptable. And then added, now a new thing, that they didn't have secured website access to provide the electronic copies, and they couldn't email them unsecured. So again, wrong.
Yeah, that's not how this works. That's not how any of this works.
And even if email security was the issue, they never even offered an alternative. Nothing. I mean, this email, it goes so far back that also, all of this is saying, I ignore HIPAA.
Oh, yeah. They don't have a clue.
Not I don't have a clue. I choose to, it's HIPAA schmippa.
That's pretty bad.
Yeah. I literally do not think I have to adhere to this law. It does not apply to me.
It is willful neglect.
Yeah.
Willful neglect.
So, I want to judge. Okay, well, the only thing, so OCR goes to the Attorney General of the United States and says, here's what we have. Here's what we said. I need you to confirm we're following the law. If we impose this civil money penalty, are we following the law? And the Attorney General said on July 15th, yes, you are.
I'm sure that wasn't good enough.
I know. So, they go through all of the stuff they have to go through. March 29th, 2022.
Going into the next year.
Yeah. They
so
send,
now we're what?
yeah. They send
3 years in?
Yeah. The notice of proposed determination, because they had not responded to the letters, the voicemails. They basically just said, you're SOL. So they even went out of their way because their civil money penalty, they calculated, and it's in the documentation how they would calculate it. And we've gone through those before. Every day that this is happening, every day that this, then there's willful neglect. Because clearly willful neglect is in there.
Yeah.
I refuse. And they go through the math. And this has gone on for years, and the patient, as far as we know, still has never gotten the records. Right? So they did the math. And because they'd never given them anything. Now, again, OCR's bending over backwards for these people still. And they make a point of saying, while Gumb's Dental has provided no evidence in response to our request, through public information, they learned it's a solo practitioner dental provider that serves an urban and suburban community. The imposition of a maximum would likely impact the ability of them to provide dental care to its service area. So they're worried about patients being able to get care.
Right.
Additionally, given the impact of COVID, they were like, we can't do what the math says we could do.
Yeah.
So we're only going to do $70,000 because the math that they could have used, and all these people who talk about how evil the government is when they're enforcing HIPAA, they could have said to this solo practitioner, you owe us. Well, first of all, I would just laugh if somebody told me I owed them that much money. I'm like, I'm out.
Yeah.
That's Consuela money right there for those that have been a long-time listener. That's Consuela money. My name is Consuela, and I'm here to serve you. $7,676,692.
34 cents.
That's what they could have hit him with.
$7.6 million.
Round up. That's 7.7.
Yeah, and they backed it down to 70,000. The price of a car.
But T90 a percentage of what they could have hit him with.
Yeah, absolutely. And what kind of shocks me is, this person didn't do anything they were supposed to do. And I'm shocked it's not more, but at the same time, I know that there have been similar dental practices who responded differently, and their amounts have been much, much lower.
Yeah. Half that, you know?
Mm-hmm.
And I mean, all they had to do is the first time, just go ahead and give them the records. That's it. Email them the records. Just be done with it. Email them the records, walk away.
Yeah. Oh, sorry, my bad. Here you go. Here's your records. OCR, I got it. I appreciate your technical assistance. This will not happen again.
Yeah. Let it go. Walk away. But no, even then.
Oh.
On September 20, they even then said, we're still appealing.
Oh, my gosh.
They want a hearing. And they got the hearing. And they said, the administrative law. So the Attorney General of the United States says this is reasonable for you to charge civil money penalties. They could have gone for $7.7 million. They went for $70,000. And then they asked for a judge. The judge reviews it, says $70,000. That's good. They appealed again.
Wow.
On March 22nd, 2024, the appeals board affirmed the decision.
Mm.
And you know it's still going on.
Yeah. This is crazy.
There's more time and effort been put into this.
Yeah. It's like the other part that scares me, though, from a patient standpoint, not just the fact that you can't get your medical records, but like I don't want my medical provider or dentist to be that freaking hard-headed.
No.
Like you're so hell-bent on being right that you're not willing to even realize you're not. Like, I don't want that type of person handling my health care, because what if you're wrong about my health care?
Exactly.
You're not even open to any other evidence or information.
What if some new treatment comes out and you don't like it?
Anything. I could be sitting in a chair and you're drilling and I'm like, oh, that hurts. You're like, no, it don't.
I know, right? You're wrong.
Yeah. I don't feel anything.
Oh, jeez.
It blows my mind that some people are so pretentious that they think that they're completely right on everything. Yeah. Even when you have the people that enforce it saying no. I mean, it's like getting pulled over for speeding. No, I wasn't speeding. You're doing 90 in a 45. No, I was doing 90. Okay, maybe I was doing that, but I was only doing that because, the person beside me was going as fast as me, and they probably would have run into another car and killed them. So I was trying to keep up with them to make sure. You're just making up stuff.
I needed to get in front of them so that they wouldn't go through the red light.
Yeah, so I could slow them down or something, so that's why I was doing 100 instead of 90. And I mean, I don't know, man. This is just, it blows my mind. But it's, if you get a letter from OCR, you should either call Cardin, you should call an attorney that's familiar with healthcare, not familiar, who definitely understands HIPAA. Like 100%.
And let me just say, I mean, I work with tons of attorneys. And I work with healthcare attorneys who actually do understand this stuff. And I work with healthcare attorneys who don't. Mm-hmm. And healthcare attorneys will come to me and say, hey, I'd like to make this argument. What do you think? Is there something in HIPAA I could use? Okay, great. I'm good with all of that. But that doesn't mean they all know it. And that they all know how to handle these OCR situations. Mm-mm. But you should never do these completely on your own.
No. But if OCR is coming back to you and giving you here it is. Here's the evidence. Here's the law. Here's what you should be doing. I mean, they're giving you everything you need to make a decision about what to do right. And you still refuse to do the right thing. I don't get it.
And I'm wondering just how much fraudulent money those claims could have gotten versus the amount of money that's been wasted in the government's time. I mean, think of all of the people who have had to spend time on this. It's probably 5 times the amount of fraud those claims could have gotten.
Well, not just that, but the $70,000 civil money penalty doesn't even cover the cost that they've put into this.
No, And they could be so much more stern.
Yeah. Like, part of me wants them to come back and go, you know what? I think 7.6 million is a pretty good number.
Yeah.
How about that?
You know,
Let's do that.
Here's the clock. Let me put you on a clock. End of 2024, you pay the 70, or we're going to the whole number.
Mm-hmm.
So,
well, I know that they don't usually do this, but what's the likelihood that they could come back and say, you know what? Let's dig deeper into your entire HIPAA program, because it ain't there.
It doesn't apply to me as the attitude across the whole board.
Yeah.
You know,
well, that's why I'm wondering, would this turn into something? No, you're right.
It won't matter. It won't matter at all. 7.7 million, and I'm still going to appeal the 70,000.
I know.
And I refuse to give you anything.
No. Look, I mean, this is why when you get pulled over for speeding and the guy's like, you're doing 25 over and this is 6 points on your license, and it's $1,000 fine, but I'm going to reduce it to 2 points and 9 miles over the speed limit, and it's only $120. You don't argue. You're just like, thank you, sir, very much. I will pay this. I won't even show up for court. I appreciate you.
Yeah, it's just, it's just,
anyway,
just provide care to the patients.
Mm-hmm.
Just provide care.
Yeah, because ultimately that's what we're talking about. I mean, we've focused a lot on the insanity that is this case, but it really boils down to the lack of patient care.
Mm-hmm. And I mean, you could be right. I'm not saying that you're wrong on whether or not. I don't know the person. I don't know the history. I don't know any of that. But the bottom line is, the line in the sand that you have drawn should just be blown away, because it's, it is not, it's not the line to get defeated on. What is that?
Yeah, the hill to die on.
That's not thank you. The hill to die on. That's it. It's not the hill to die on. Please don't do that. It's really not. I mean, if you're gonna go somewhere where you at least have footing.
Yeah.
It's just vapor that you've created in your head. Like the Roadrunner coyote, where the coyote runs off the edge of the cliff and hangs there for a minute and then falls.
Yeah. But, as bad as this is, how many times has this happened? Not just with this practice, but how many times does it happen when people don't know they can file complaints, or they don't file complaints, or they do file complaints and the person's like, oh, sorry. I mean, I feel like when these things come out, it's kind of like when anybody files a complaint with your business, that if somebody took the time to tell you something was wrong, there's probably a dozen more people out there, that didn't take that time to do that. So it's not the first.
Yeah. And you and I are the same. Integrity is everything.
Mm-hmm.
And if I'm wrong, which we both know it's rare, but we are. Just kidding. I'm often wrong.
Yeah.
I have a lot of people who will tell you that. But
no, what is the saying? I'm never wrong, but I'm often mistaken.
Yeah, that's right. But, to say I have a thing, to save time, let's just assume I'm never wrong. But this is the time to stop. This is the time to stop. There's got to be a lot more happening there. But I mean, seriously, stop.
Why would you go out of your way to fight this when it literally was nothing more than just give them the medical records?
Send an email.
And you initially, I mean, the funny thing is, if you really look at it, the whole thing was because you didn't get $25 you thought you should have got.
It wasn't even that. It wasn't even that. The $25 didn't come into play really ever. I don't know that the patient was ever told the $25.
Probably not. But that was her first offense, right?
Well, the first offense was that, even though the patient asked for it via email.
It's insanity. Yeah, it is. But
I don't understand it. And, I hope that we can all realize, this is the 50th one, and it's the crazy one. That makes, patients have a right to these things. And if you suspect other things are going on, report it to the proper authorities. That's what you do. That's what we all do. If you think something's going on, report it. But that's it. Done.
Yep.
That's it. And so, again, maybe this person really did want to go to another dentist, and that's why they were asking.
Mm-hmm.
Who knows?
Well, I think this should change the name of the practice.
Uh-oh.
Instead of being Gumb's Dental Care, it should be Dadgum Dental Care.
There we go.
All right, folks, that is our show for today. Thanks for listening. Be sure to share this out like Alex does. Share it with somebody. We appreciate it. And leave us a rating. We appreciate those as well. Be sure to join us again next week. And remember, HIPAA is not about compliance. It's about patient care.
Help me with HIPAA. Let's get it right. Protect your patients day and night. Donna and David, the experts on your side. Help me with HIPAA. Let's get it right.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.